Bottom line is, everybody here knows we have a major crisis in terms of the shortage of doctors. It is getting worse. It is worse in primary care. It is worse in rural and underserved areas. Let's support this amendment.
This amendment is unrelated to the underlying bill on generic drugs. Adopting it prevents this bipartisan bill, from advancing at today's markup. This committee has worked to ensure that funding for the National Health Service Corps does not lapse, and it will not lapse this year. Earlier this year, we increased funding for this program in a paid-for bipartisan agreement. The sum $415 million in new spending is not offset by the savings of the bill, nor does the
America is facing a doctor shortage crisis, and it's only getting worse. Senator Bernie Sanders just proposed nearly $1 billion a year to train and place more doctors in underserved communities. But Republicans called it a political stunt and a poison pill that could derail a bipartisan healthcare bill. The vote came down to just one vote, 12 to 11, and the amendment was killed. Was this a missed opportunity to fix healthcare, or was it the wrong bill at the wrong time? Watch what happened.
Anyone have another amendment they wish to call up?
I do, Mr. Chairman. Sanders Amendment number 4. Mr. Chairman, we are facing a shortage of more than 187,000 doctors over the next 12 years, including a shortage of tens of thousands of primary care physicians. The National Health Service Corps provides scholarships and loan repayment to primary care providers who commit to practicing in an underserved area, but the program is woefully underfunded. Today, National Health Service Corps scholarship funds are sufficient to fund just 10% of the applications received for new awards. According to the latest available data, 43% of eligible medical providers who applied for this program did not receive funding. While Congress provided a 13% increase in funding for this program, that increase is nowhere near what is required to fully fund the program. The Association of Clinicians for the Underserved estimates that the National Health Service Corps needs at least $950 million annually to provide scholarships and loan repayment programs to all eligible clinicians. Bottom line is, everybody here knows we have a major crisis in terms of the shortage of doctors. It is getting worse. It is worse in primary care. It is worse in rural and underserved areas. Let's support this amendment.
This amendment is unrelated to the underlying bill on generic drugs. Adopting it prevents this bipartisan bill, from advancing at today's markup. This committee has worked to ensure that funding for the National Health Service Corps does not lapse, and it will not lapse this year. Earlier this year, we increased funding for this program in a paid-for bipartisan agreement. The sum $415 million in new spending is not offset by the savings of the bill, nor does the bill have technical assistance to explain how the additional funding would be allocated. This is a political messaging amendment which is not in good faith. I am committed to working towards a positive outcome in the public health extender funding as part of our July markup and making sure they don't expire at the end of the year. I urge colleagues to oppose this poison pill effort. I oppose them to stand up for regular order in the Congress, and I make a motion to table the amendment. The clerk shall call the roll. I shall be voting yes to table.
Senator Paul?
Senator Paul is yes by proxy.
Senator Collins? Aye. Senator Murkowski? Senator Marshall? Aye. Senator Scott? Aye. Senator Hawley?
Aye by proxy.
Senator Tuberville?
Aye by proxy.
Senator Banks?
Aye by proxy.
Senator Husted? Aye. Senator Moody?
Aye by proxy for Armstrong.
Senator Armstrong, proxy. All right. Senator Sanders?
Nope.
Senator Murray?
No by proxy.
Senator Baldwin?
No.
Senator Murphy? Senator Kane?
No by proxy.
Senator Hassan?
No.
Senator Hickenlooper?
No by proxy.
Senator Markey?
No by proxy.
Senator Kim? No. Senator Blunt Rochester? No. Senator Alter-Brooks?
No.
Chairman Cassidy?
Aye to table.
12 ayes, 11 nays.
The amendment is tabled. Does anyone have?
The amendment failed by a razor-thin margin, but the debate exposed a major issue. America desperately needs more doctors, especially in rural and low-income communities. Supporters say Congress is ignoring a healthcare emergency, while opponents argue that massive new spending needs proper review and funding sources. The question remains, should politics stand in the way of expanding healthcare access, Or was this amendment simply not the right solution? Let us know your thoughts in the comments.